Hello and welcome to McLaren Port Huron Today's Health Program. I'm your host, Kelly DiNardo. In today's program, we are speaking with board-certified orthopedic surgeon, Dr. Timothy Lukas, about hip pain as it relates to aging. So Dr. Lukas, thanks so much for joining us today.
Oh, thank you for having me.
So let's talk a little bit about your training.
So, as you mentioned, I'm a board-certified orthopedic surgeon. I'm also a fellow of the American Academy of Orthopedic Surgeons. I've been in Michigan now for 25 years, practicing in Port Huron for 20 years. I did my training at Henry Ford Hospital, where I did a 5-year residency in orthopedic surgery, and I served as chief resident. And then for medical school, I was at UT Southwestern in Dallas.
That's very interesting, and you've lost a little bit of your accent, I can tell, right?
25 years in Michigan, that's what
right.
I'll do for you.
So in today's program, we're talking about hip pain. So let's start with the anatomy of the hip.
Sure. So we'll put the x-ray up. The hip is a ball and socket joint, one of the largest joints in the body. And so again, a ball and a socket, and then between the ball and the socket you have this cushion or cartilage. That's represented by this space in this normal appearing hip on the x-ray. Surrounding the hip you have several large muscles in addition to ligaments that give it stability and hold it in place. So
what are the main causes of hip pain as we age?
Hip pain generally over the years develops from arthritis. Arthritis is caused by wear and tear. So all those small injuries you had when you were younger, they add up, they do damage to the cartilage, they do damage to the structures around the hip, and over time the remainder of the cartilage wears out and causes arthritis, and that's what causes most pain for most people. Although some people, there are other causes you have to rule out. Problems with your lower back, autoimmune processes like rheumatoid arthritis, some other things to consider when you're looking at somebody with hip pain.
What does a patient usually, when they present to your office and they say they have hip pain, where do they actually point to where is it right in the groin or is it in the outside of the hip?
So that's one of the keys to figuring out what the cause of the pain is the location. Posterior pain tends to be related to the lower back. Anterior groin and thigh pain tends to be more the hip joint itself.
Yep, so where people would think their hip is, that might not necessarily be related to their hip, right? It could be.
Correct. I see lots of patients that come in that really have an arthritic back that think they have a hip problem and actually don't.
Right. So what are some of the other symptoms that people may experience?
So people with hip arthritis tend to have problems with stiffness. So they have problems tying their shoes, putting on their shoes and socks. They also have pain mostly when they put weight on that leg. So when they're walking, they tend to have a little bit of a limp. They feel that pain getting worse. They also get stiff when they sit for periods of time. They're trying to get up and they feel that stiffness. They kind of have to work it out.
So for most people then, first thing in the morning, getting out of bed and they're...
Correct, yeah. You feel 100 years old when you're not.
Right. So how do you diagnose then any issues with the hip?
So the key is to be seen by an expert in hip arthritis and hip treatments. So what I do is I take a thorough history, find out when they hurt, where they hurt, how long it's been going on, trying to localize things that way. And then I do a physical examination, checking out the range of motion of that particular joint compared to the other joint. Make sure the pain isn't coming from other causes like the lower back. Then I watch people walk to see what their gait looks like too. And then once I have that information, then I'll get additional testing like an x-ray to look for the joint space, look for the cartilage wear on x-ray. And rarely I'll do an MRI if I suspect other causes.
Very good. This has been really good information, but we do need to take a short break, but we will continue this discussion when we return.